Hysterectomy means to remove the uterus, and sometimes in conjunction also with tubes and ovaries. This is the definitive procedure for correction of a number of different abnormalities that don't respond to any medical therapy, such as heavy bleeding, diseases that cause a lot of pain, such as endometriosis, and of course cancer. In the benign cases, non-cancer cases, we strive always to do it vaginally. That means with no abdominal incision, and the reason for that is the patient's recovery time is shorter, her experience in the hospital is a lot better, and blood loss is usually less. We've also developed a technique called laparoscopic assisted vaginal hysterectomy, which simply means that we do most of the hysterectomy through 2 little laparoscopic incisions, and that allows us to do cases that might ordinarily have had to be open and then end up taking the uterus out through the vagina, so the patient very closely approximates the vaginal hysterectomy benefits. There are extremely large uteri, cancer cases and so on that have to be done through transverse or vertical incision, and what you do is you make sure that you tailor it to what's appropriate for the patient's case. But once again, we try to do most of our cases vaginally because with some anesthetic techniques that are used now has transformed it essentially to an overnight stay in the hospital and a very quick return back to work. Up to 50% in some surveys say that most hysterectomies are still being done abdominally when they really wouldn't have to be. That's a little worrisome from me as a clinician because every bit of data says that they benefit from vaginal approach, and at Grace all the physicians try to strive to that goal.